Hello, everyone. Thank you for joining the first session of year 2 of our Journey of Healing training series titled SOAR for Indigenous Communities. My name is Maddie Curry. I am an enrolled descendant of the Amskapi Bikuni, or the Blackfeet Nation, and I'm also a public health program manager at the National Council of Urban Indian Health, known as NCUI. Joining me from the NCUI team are Aaliyah Smith-Comas, our project coordinator for this program, as well as Amy Lord, who's our website consultant. And we are honored to have you all here today, so thank you for joining us. We kindly ask that you place your name, your tribal affiliation, if any, and your title into the chat box, as well as your organization. In addition, we welcome any feedback you would like to provide about your webinar experience in our survey, which will be posted in the chat box as well. Next slide. As we dive into our session, there's a few things that we would like to keep in mind. So first, note that this session is being recorded. All microphones have been muted unless otherwise directed. Your questions can be typed in the chat box, and then we'll have a Q&A session at the end of the session. So question and answer at the end. Save your questions for the end. Next slide, please. Okay, so as shown in this agenda, our presenter, Annie, will provide a detailed presentation of the Stop, Observe, Act, and Respond framework, or commonly known as SOAR. We will end this session with Q&A, as just said, and survey reminders, and then also sharing our upcoming opportunities at NCUI. Next slide. So to provide a little background on us, the National Council of Urban Indian Health, also known as NCUI, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUI is the national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service and the Indian Healthcare Improvement Act, or IKEA. NCUI strives to improve the health of over the 70% of the American Indian and Alaska Native population that lives in urban areas, supported by these quality healthcare centers. Next slide. We also want to take a moment to recognize that addressing missing and murdered Indigenous people, and more specifically American Indian and Alaska Native deaths, is an incredibly sensitive topic that might affect some participants today more than others. If you find yourself impacted by today's discussion, please connect with your support networks or reach out to NCUI, and we can provide you with healing resources. Next slide. So now I will introduce our wonderful presenter. So Annie LaFrinier-Ritchie works as a Safe Harbor Regional Navigator for Someplace Safe in West Central Minnesota. Annie has been working in the anti-trafficking field in direct services and training and technical assistance since 2016. She is a 2020 graduate of the National Human Trafficking Training and Technical Assistance Center Human Trafficking Leadership Academy Class 5, which developed recommendations on how culture can be used as a protective factor against human trafficking among Indigenous youth. Annie consults federally on several projects and has created an Indigenous trafficking curriculum. And Annie is an active member of the YWCA Cass Clay Racial Justice Committee and serves on the board of the Indigenous Association of Fargo-Moorhead, YWCA Cash Clay, and Mending the Sacred Hoop, and is a member of the Minnesota's MMIR Office Advisory Committee. She also provides training and technical assistance on the state and federal levels on providing culturally responsive services to Indigenous youth and families. And we will now turn it over to Annie for her presentation. So again, thank you for being with us today.
Awesome, miigwech. Anim buju nin Annie. Thank you. Anim buju nin Annie Dishnakas, Galabada Ganakagan Dunjaba, Ajijakandudem. Minoki Jagad all, thank you so much for being here today. If you want to advance to the next slide, please. Perfect. So I will be sharing with you all today the SOAR for Indigenous Communities framework. And if you can go to the next slide, please. Just a brief overview of what today's content will cover. First of all, I'm going to talk about historical factors that contribute to the trafficking, including labor and sex trafficking of Indigenous populations. We will talk about what trafficking looks like in Indigenous communities and discuss indicators of trafficking. I'll also describe trafficking resources relevant to Indigenous populations. We will look at methods of honoring cultural practices while providing support to individuals who have experienced trafficking. And then finally, we will cover ways to strengthen cross-jurisdictional collaborations to build comprehensive responses to trafficking in Indigenous communities. And next slide, please. Excellent. So I just wanted to really briefly cover what the SOAR framework looks like before we get into it. So the SOAR framework is a framework that provides a really quick mental reference to keep in mind how to help individuals in Indigenous communities who may have experienced trafficking. It is a trauma-informed approach that encourages professionals to be mindful of the experiences individuals have had that may cause trauma. And so then we have these, SOAR stands for first and foremost, STOP, which is describing the types of trafficking and common risk factors in Indigenous communities. Sorry, guys, I'm apparently stuttering today. And then we have Observe, which is identifying individual and environmental indicators of trafficking in Indigenous communities. We have Ask, which is screening and identifying individuals who have experienced trafficking or who have increased risk factors for trafficking, using this trauma-informed, person-centered approach. And then finally, we have Respond, which is addressing individual needs by coordinating across multidisciplinary partners to deliver appropriate services in culturally sensitive ways. Next slide, please. So I wanted to just share a disclaimer. The topics that we're discussing today in this module do not define our audience, right? And these are an overview of what trafficking looks like. It does not include all examples of what trafficking is, and just recognizing that there are also 374 federally recognized tribes in the United States, which means that there's going to be a lot of variety in what we see from community to community. So just keeping that in mind as we go through today's presentation. Next slide, please. All right, so we're going to start with SOAR, with STOP, which is the first letter in SOAR, which is, again, describing the types of trafficking. And in this module, again, we're going to talk about what STOP looks like. So next slide. And before we get into identification, first of all, we want to look at what is human trafficking. So when you hear the term human trafficking, it could be referring to either labor trafficking or sex trafficking. And labor trafficking is recruitment, harboring, transportation, provision, obtainment of a person for labor or services through the use of force, fraud, or coercion for the purpose of subjection to involuntary servitude, peonage, debt bondage, or slavery. And before we even get into the next definition, I just want you guys to know that we do have kind of a handier way of understanding what both of these types of trafficking look like. So first we share this legal definition, and then we'll kind of break down what it looks like. So sex trafficking is also recruitment, harboring, transportation, provision, obtaining, and additionally, solicitation or patronizing of an individual for the purpose of a commercial sex act, in which the commercial sex act is induced by force, fraud, or coercion, again, those terms, or in which the person who is being required to perform such act has not yet turned 18. So anyone under the age of 18 does not have to experience force, fraud, or coercion to have been sex trafficked. And in the Trafficking Victims Protection Act, the term commercial sex act means any sex act on account of which anything of value is given to or received by any person. Next slide. Okay, so here's a more easier, simpler definition, kind of breakdown of what it looks like. In order for somebody to be experiencing human trafficking, there really has to be these three separate parts. We have an action, a means, and a purpose. And so then breaking that down again into a little bit more simpler definition, what we see as actions are, again, that recruiting. So they may be posting ads online, they may be posting ads in communities, they're harboring, maybe these people are staying within this person's home, or they're providing hotel rooms or other places for these individuals to stay. They might be transporting, they may be providing. So again, providing a person for this. They may be obtaining, so they may be receiving a person for these types of activities. Or again, they may be patronizing, soliciting, or advertising. And again, these last three actions are specific to sex trafficking only. Then again, when we're looking at the means, we have force, so that can be physical abuse, it can be sexual assault, different types of these physical force that an individual may be experiencing, or they may be experiencing fraud. So they may have some sort of false promises. Maybe somebody's posting ads or promising work that is not actually what it looks like. So again, they have been defrauded when coming into this work, or they're experiencing coercion. So coercion could be blackmail, it could be threats, right? So they may have one thing that I've seen is an individual may have a trafficker who says, you know, if you don't do this for me, then I'm going to find one of your family members or one of your siblings and force them into it. So there isn't any physical force, but this person still feels compelled or required to participate in this form of trafficking. And then again, remembering that if somebody's under the age of 18, they do not have to experience this physical force, fraud, or coercion to experience sex trafficking. And then finally, we have the purpose, right? And the purpose is either commercial sex or some form of labor. Next slide, please. So again, force, fraud, or coercion, as I shared some of those examples with you all, we see false promises. Again, it could be regarding actual employment, so the work may not look like what they're saying it looks like. It may be false promises about wages. It might be false promises about work conditions or other matters. We also see an example, maybe an Indigenous person is lured away from their community or reservation with promises of a better life, a better paying job, maybe a more exciting lifestyle. And then they find themselves in a vulnerable situation in an unfamiliar place. Similarly, people who grew up in cities and more urban settings may live in poverty or feel disconnected from their culture, and then may find themselves vulnerable as they struggle to find quality job opportunities. When we see coercion, again, that can be manipulation, can be threats of serious harm or physical restraint to a person, or it can include family members, loved ones, and it can also include other individuals who may be experiencing exploitation by the trafficker. We'll talk more about the historical context of human trafficking in Indigenous communities, but for now, just knowing that Indigenous individuals and populations may be more susceptible to coercion, in part because of historical trauma. And then finally, when we talked about force, that again can be physical restraint or serious physical harm, again, sexual assault, physical abuse, physical confinement are often used as a means of control, especially during early stages of exploitation when a trafficker is really breaking down that individual's resistance. Next slide, please. So minors who are induced into commercial sex are victims of trafficking, again, regardless of whether force, fraud, or coercion have been used. Next slide. Thank you. So when we talk about human trafficking, it's really important to note that here in the United States, in many of our states, we do really use a public health approach to responding to human trafficking. And this public health approach recognizes that interrelated violence and systemic inequities are influenced by these social determinants of health, which are circumstances that people are born into, they grow up in, live in, and work in that impact their health. So some examples include race, location, income. And some communities are more likely to experience violence and trafficking due to social determinants of health. An understanding of how these circumstances intersect with risk factors for trafficking and also disproportionately affect people who you work with can be used to inform your prevention and intervention strategies. So it's important to know that while anyone can be affected by trafficking, there are certain factors that do contribute to a disproportionately higher risk, which include this history of abuse and neglect, social disconnection, social stigma and exclusion, and then the systemic inequities and inequalities, excuse me. So we'll discuss these factors in specific populations to keep in mind in greater depth throughout this presentation. Next slide, please. We do see in human trafficking that there are additional populations, again, who are experiencing an increased risk for human trafficking. And in our efforts to address trafficking, it's important to consider women, girls, and other populations that may disproportionately experience factors that place them at an increased risk. So these critical populations include individuals with substance use and co-occurring disorders, individuals who are experiencing homelessness, people of color, youth who are disconnected, whether they are systems involved, maybe again, individuals under 18 who are experiencing homelessness, folks who are from immigrant communities, migrant and seasonal workers, again, Indigenous communities specifically, individuals who identify as LGBTQ, Two-Spirit plus, and then individuals with disabilities, survivors of other forms of violence, boys and men, older adults, and in-home workers. So we will talk more about these risks as well, but just it's important to note that some individuals may be experiencing or may identify with a number of these different populations, which again are really, really increasing their risk for trafficking and exploitation. Next slide. So this graphic is something that was created in my work with the Human Trafficking Leadership Academy, where we were looking at ways that culture can be used as a protective factor against trafficking among Indigenous youth. And we really wanted to dig deeper into better understanding before we go into these protective factors, what are our specific risk factors? And we identified that these risk factors really occur across 5 separate levels for individuals. And so then first and foremost, on an individual level, we're really seeing different things that are happening in an individual's life that increase their risk for trafficking. And that can be prior systems involvement. Depending on the state that you're in, there are, particularly in the Midwest where I'm from, our Indigenous youth are at incredibly high risk for involvement in the systems. And whether that is child protection, juvenile justice, or mental health systems. We also unfortunately see individuals who have had a loss of cultural identity through historical trauma are also at higher risk for trafficking, experiencing systemic oppression, again, maybe not having access to basic needs or being barred from accessing basic needs because of their racial identity. We also see lack of housing, inadequate support systems, and then marginalization for race or ethnicity. And then on a relationship level, we're seeing higher risks occurring within dysfunctions in homes, individuals who are experiencing physical or sexual abuse, maybe, again, young people who have had disconnection from culture, either themselves or something that's been passed down from generation to generation. Also, we see this lack of positive role models. Again, we don't still see a ton of options, either locally on the state level or nationally, for what Indigenous people can grow up to be. And so then they're not really seeing a ton of options for themselves to be successful. We also see insufficient assistance for family preservation, really leading to this exacerbation, increased involvement in systems, et cetera, really leading to these higher risks for trafficking. Within the community, we're seeing different risk factors for trafficking, including higher rates of substance abuse. Communities where we have higher gang activity and gang involvement also leads to higher rates of both sex and labor trafficking. In communities where there are scarce higher education or economic opportunities, so not a lot of options for young people and adults to really meet basic needs, to thrive and be successful. Also, when we have an absence of trafficking awareness and cultural healing resources. So if we don't know what the problem is, and really all we're seeing is things in the media, social media, movies, TV shows, then it's really not portraying to us accurately what trafficking looks like and what we need to be aware of and how we can keep ourselves safe. On a societal level, we also see issues of demand, right? So we live in a society that thinks it's okay to pay for sex. So then when we have that as something that's socially acceptable, then we also see issues of sex trafficking. We also have weak trafficking laws and codes. And then there are jurisdictional issues. So particularly depending on the state that you reside in, I always share examples of Minnesota. Minnesota is a public law 280 state. However, we do have some tribes that are not a part of Public Law 280. So depending on where a crime occurs, the law enforcement entity that responds to it could be state law enforcement, could be county law enforcement, could be tribal police, could be the Bureau of Indian Affairs, could be the FBI. So all of these jurisdictional issues often make things more complicated in terms of response and investigation. We also see higher rates of trafficking and exploitation occurring in areas where there are amounts of natural resource extraction. And unfortunately, we know that there are higher examples of natural resource extraction occurring in and near our tribal communities. Again, racism on a societal level really impacting Indigenous people when it comes to trafficking. We see really low amounts of support for individuals who are re-entering into communities out of incarceration or other types of placement. And then on a historical level, we see those issues of colonialism, generational and historical trauma, these destructive federal policies, really low prosecution of human trafficking cases, and then finally within Indigenous people, an overall distrust of these systems because of all of the things that have happened to us over the past 500 years. Next slide, please. So there is a correlation between the MMIP crisis and trafficking. And we see really this overlap in risk factors for both forms of violence. And those common risk factors include, again, exposure to various forms of violence, particularly for young people. Maybe they have experienced both physical abuse and sexual abuse. Maybe they have experienced intimate partner dating violence and other forms of community violence. So this really just multiple incidences of violence occurring within their lifetimes in history. Also, again, experiencing issues of unstable housing, really overlapping with substance use. We do see a high correlation of substance use and human trafficking, particularly sex trafficking, both as a way to keep people trapped in sex trafficking and also as a way to lure people in. We also see issues where there's low educational attainment or really poor quality of the education that is available for young people. Folks who live in communities of poverty are often lured into trafficking, and unfortunately, poverty really is something that does tie into the MMIP crisis as well. We see psychological and emotional vulnerability, really looking at those previous experiences of violence and other forms of trauma in their lives. And then finally, lack of social support and safety. Next slide, please. So we also see overlaps between MMIP, trafficking, and extractive industries. And what this looks like is really truly this relationship between these issues, because some industries, including the extraction of natural resources, draw large numbers of temporary workers to small communities. So I'm thinking particularly of North Dakota, kind of near the MHA Nation. And in these areas, we also see man camps, right? We see rural reservations, which are typically isolated from supportive resources, being located near these man camps, which are then providing an ideal setting for traffickers to take advantage of their victims. For many Indigenous communities, extraction of natural resources is a violation of the land. And along with this rapid population in small communities where extraction occurs, often comes shortages in resources and supplies. And additionally, law enforcement response is limited as resources are stretched. So the demand for commercial sex industry increases, leading to an increased risk of exploitation of Indigenous people. There was a report from the United Nations Human Rights Council that found multinational corporations and extractive industries that operate with impunity on Indigenous people's territories have a detrimental impact on Indigenous women and girls, which then manifests itself in sexual assault, sex trafficking, prostitution, bonded labor, exploitation of overseas contract workers, the internal displacement of women, and environmental violence, and unique ecological, economic, and spiritual impacts on Indigenous women in their role as traditional caretakers of the environment. So bad all around, right? Next slide, please. Talking about these social and environmental risk factors. So we have social and environmental circumstances in which a person is born, grows up, lives, and works in that affect their physical, mental, and emotional health and development. These circumstances also affect a person's risk of exposure to trauma, and trauma and stress are highly prevalent in our society and vary among cultures. So trafficking is usually not an individual's first experience with trauma. Adverse childhood experiences, or ACEs, are stressful or traumatic events that occur during childhood, and ACEs encompass several issues such as abuse, neglect, household dysfunction, and are strongly related to the development and prevalence of many risk outcomes throughout a person's lifespan, including health problems and trafficking. Next slide, please. And so here we have an expansion of this ACE pyramid. And historically, measures of ACEs included childhood trauma exposure across a small subset of items. This early research yielded useful data for examining the impact trauma exposure has on later adult health outcomes. However, it was limited. Expanded definitions of ACEs takes into consideration experiences such as bullying, discrimination, racial inequity, community violence, parental death, and economic hardships, and their impact on health, which includes changes in gene expression, also known as epigenetics. So in a study that was conducted by the Philadelphia ACE Project that considered these additional categories, 83.2% of over 1,000 participants had at least one adverse childhood experience. This social ecological framework helps us better understand the complexity and interconnectedness of ACEs, the social determinants of health, and health outcomes. We know that our Indigenous communities have experienced severe forms of interpersonal and systemic trauma and discrimination, which includes involuntary removal of children, abuse in boarding schools, extreme poverty on reservations, military action, infectious diseases, and involuntary removal from our homelands. These types of intergenerational and vicarious traumas are passed down to younger generations, and science shows that intergenerational trauma does have an impact on our DNA. Next slide, please. So this image on our screen really captures the original types of ACEs, which are in the center there, childhood abuse, neglect, household dysfunction, as a central nucleus. The surrounding items consist of additional ACEs, such as exposure to bullying, community violence, neighborhood safety, racism, living in foster care. Consider stories you have seen or heard related to community violence, bullying, living in foster care, and racism on social media or in the news over the past 10 years. While doing this, imagine how these stories might impact the life of a child you are working with. This impact should be considered for those who have personally experienced it and those who have witnessed it. Now consider that the original ACEs study did not factor in any of these variables, limiting our understanding of the diverse experiences among children who are Black, Indigenous, people of color, Two-Spirit, LGBTQIA+, and other economically or socially marginalized groups. Indigenous communities experience ACEs at a much higher rate than their counterparts. And one example of an ACE that negatively impacted Indigenous families was the forced removal of children from tribes and placement into boarding schools. While forced removal no longer occurs, many current community members experience this firsthand. And those who endured this abuse have an increased likelihood to abuse their own children, perpetuating a cycle of abuse. Next slide, please. So as the number of ACEs increases, the number of risk outcomes increases, including the risk for human trafficking. While exposure to ACEs may impact adult health outcomes and or vulnerability to trafficking, ACEs are also not static predictors of either. So gathered insights that relate to these experiences should be used as a tool in overall evaluation. For example, most individuals access a variety of services across their lifespan, giving providers the opportunity to intervene and help mitigate the negative impact of ACEs. Providers are uniquely positioned to intervene and provide the appropriate care to ensure that those who have experienced ACEs go on to live healthy lives. And we will talk more about protective factors and promoting resilience further on in our training today, which is my favorite part of the conversation. Next slide, please. So again, exposure to ACEs alone does not necessarily predict whether someone will experience exploitation. There are a variety of intersectional issues, which include unaddressed ACEs that increase the risk of exploitation, especially when layered. So the graphic you see here illustrates other important factors, including social determinants of health. So when we're talking about intersectionality, we're referring to this complex cumulative circumstances that are created by multiple inequities. And it's really important to consider how multiple components of identity, such as race, gender identity, and sexuality, power relations, and life experiences interact. So, for example, youth who identify across multiple groups that have been under-resourced or marginalized face increased vulnerability to coercion and an increased likelihood of experiencing trafficking. Consider that youth who experience abuse are more likely to run away. Approximately 40% of youth experiencing homelessness identify as Two-Spirit or LGBTQIA+, and 1 in 6 of the more 25,000 cases of children reporting to the National Center for Missing and Exploited Children in 2021 who had run away had likely experienced sex trafficking. Next slide, please. So in order for us to proactively protect Indigenous communities, we must first take a walk upstream to look at the key factors that increase the risk of exploitation. And these include the social determinants of health, such as economic stability, housing and food security, family supports, and access to human services. And possible interventions include allocating specific funding to tribes to address housing insecurities on reservations and in urban Indigenous communities, building the capacity of communities to support employment and educational assistance needs to provide economic self-sufficiency, developing and implementing culturally informed prevention programs designed to support the needs of today's Indigenous youth, providing trauma-informed care in schools to youth who have experienced trauma, providing adequate prevention and intervention programming that addresses substance use and mental health needs, and supporting community healing, and then allocating resources to support data collection methods, correcting misrepresentations, and implementing protocols to provide mechanisms for leveraging data. Next slide, please. All right, I believe now we have a poll for you all to participate in. So just a quick quiz on your knowledge and what you've learned so far. Which of the following characteristics puts an Indigenous person at increased risk of experiencing trafficking? And then true or false, when screening an individual who may have experienced trafficking, providers should get as much information as possible about the situation. Interesting. That second one is a trick question for y'all. Let's just give it another moment for folks to have an opportunity to answer the question, share what you think, and then we will continue on. Also, are you able to share results so we can all see the answers? Yes, excellent. Okay, perfect. So you all did a really great job. The answer is all of the above, right? All of these issues do put an individual at an increased risk for experiencing sex trafficking. Thank you so much. All right, next slide, please. All right, we are going to transition into the next section of our SOAR response framework. So this section focuses on observe, which is identifying individual and environmental indicators of trafficking in Indigenous communities. Next slide, please. And I love this graphic. So to move forward, we must first talk about what has happened. Although trafficking occurs, although trafficking occurs in Indigenous communities now, it is important to recognize that this was not always the case. Next slide, please. So we're just going to briefly talk about historical trauma, which is the cumulative, multi-generational, collective experience of emotional and psychological injury in communities and descendants. And this is something that was created by Maria Yellow Horse Braveheart, and this attributes that to 2003, though she was working on that prior to 2003 as well. And when we see historical trauma in communities, it's really important for us to understand and recognize that this is the legacy of colonization, forced relocation away from historic lands, separation from our parents and families, placement of children in boarding schools or foster care, and other trauma that really continues to impact us today. And it can result in defense mechanisms and developmental and behavioral issues among possible manifestations that are shown here, right? So I'm not going to go through all of these different examples, but you guys do see a list here. And it's important to view these behaviors through a trauma-informed lens. So recognizing that many issues impacting Indigenous communities and families stem from historical trauma does not mean that these behaviors are acceptable, but it is helpful for us to kind of understand this root cause. Next slide, please. So now we're going to talk about some potential indicators of human trafficking. And first, we will share what they look like, again, in a variety of different settings. And while it's critical that service providers consider each patient or client individually, recognizing these indicators of trafficking may be the first step towards ensuring that this individual receives the care that they need. So I want to share that these examples are not a definitive list, and not every individual will present the same red flags. So thinking about how upstream determinants of trafficking and how those issues might raise red flags in your workplace. And then we will first talk about some physical red flags. So what you may see in terms of physical red flags is the individual may have untreated or undertreated workplace injuries. They may have bruising or burns, and I can just share in my role as a trafficking provider, as we've seen a very large number of trafficking survivors with specifically cigarette burns. They may have experienced exposure to toxic chemicals. They may have respiratory issues. The individual may have had multiple pregnancies, and they may have been terminated. They may have not been carried to full term, or conversely, they have had multiple pregnancies that have been carried to term. They may have physical impacts of long-term trauma. They may be showing frequent treatment for sexually transmitted infections and injuries. They may be showing signs of physical and sexual abuse. They may have communicable and non-communicable diseases, such as tuberculosis, hepatitis. Those are some examples. They, again, may be experiencing and showing signs of substance use. They may have dental issues, and they may have tattoos or burns or other scarring, really specifically to indicate branding. So something that a trafficker has used to really show ownership of the individual, whether that is through a tattoo or scars or types of burns. Some behavioral red flags that we say may be confusing or contradicting stories, right? So this person's, what they're telling you may not be the same story every time they share it. They may have an inability to focus or concentrate. They may be unaware of their location, their age, or the time. They may be protecting the person that hurt them, or they may be minimizing the abuse. They may be experiencing or sharing guilt or shame about the experience that they've had. They may be reserved, they may be avoiding interaction, or they may be providing incredibly limited information. They may be showing signs of psychological trauma. They may be showing signs of depression or other anxiety disorders. They may have inappropriate sexual behavior, particularly for children and young adolescents. They may have knowledge or behavior that is really outside of the typical range for their age. There may be a fear of appointments that are taking longer than expected. So again, worry about kind of what's happening behind the scenes. And they may be reporting the need to update a spouse, friend, or a significant other. So there may be somebody that they're checking in with, whether that is through text message or phone calls, kind of on a pretty excessive basis. So making sure that somebody's really kept in the loop on every single move that they're making. In terms of environmental red flags, we may see that the individual is accompanied by another person who's answering questions for them, and maybe is preventing them from speaking freely. They may be constantly accompanied by a person who won't leave them alone, right? So they may be coming into all of their appointments, sitting close to them, again, really monitoring everything that they're doing. And I think that it's really important, particularly as a provider, we hear this, and a lot of times people automatically think it's a female with a man who is controlling. It may seem like it may be a female, right? So it may be somebody that is identified as a friend or a family member, just recognizing that traffickers are not only males, particularly in family settings. They may be in school settings, there may be changes in behaviors. Students are no longer coming to school when they should. They may be wearing the wrong clothing based on the season. They may be living at work or living in overcrowded locations. They may be reporting that they're not allowed to take adequate breaks, eat, or drink at work. They may share that they were recruited for different work than they're actually doing. There may be minors who are experiencing homelessness, or they're not living with relatives or with foster parents. So for example, they could be living in a motel. They may be living with non-relatives, particularly who are several years older, or they may be sharing incidences of sexual harassment at work. Next slide, please. So we see that individuals who are at risk for trafficking who have experienced trafficking are often really not recognized for various reasons. These barriers to identification really fall into these two separate categories. We see individual related barriers and then provider related barriers. So when we talk about individual related barriers, a person experiencing trafficking may not self-identify for many reasons. Given the complex jurisdictional challenges faced by so many Indigenous communities, as well as historical discrepancies in the number of cases that are successfully investigated and federally prosecuted. So some pretty big issues there. We also see an individual that may distrust the system, and they may fear reporting because they believe nothing will be done. The history of child removal for boarding schools and child protective services may also influence a lack of distrust and disclosure as well. So they may lack awareness of what they're experiencing, that it is trafficking. They may lack understanding of victim and legal rights. There again, that issue of complicated legal jurisdictions. They may lack identification in other records, and I say may, so I will say again, in the 8 years that I've been in the field, and I often am asking colleagues about this across kind of the Midwest, and really by and large across the board, the folks that we serve who are survivors of trafficking almost never have any identification or records. So that's kind of usually one of the first things that we're working on with people. So I say may, but at least in my experience, it's been 100% of the time. They also may have a cultural barrier that is due to gender roles and cultural norms or formalities. There may be language barriers. They may fear law enforcement, right? So they may not want to report because they really are uninterested in talking to law enforcement. They maybe are afraid of disrupting a close-knit family unit. There may be fears of lack of stability if their trafficker is a parent or a relative, right? So this is somebody that they're living with who's responsible for caring for them, is housing them, etc. And they really don't want to rock the boat or change that. They may be afraid that they're not going to be trusted or believed. They may fear that children may be taken by child protective services, right? So there may be some consequences if they are parenting as well. There could be fears that reporting could lead to being returned to an abusive home, jail, or foster care placement, particularly for folks who are minors. Their trafficker may hold a leadership position in the tribe, or their trafficker may hold a cultural position as well. So maybe a respected cultural leader. They may depend on their trafficker for drugs or emotional support. Maybe they feel like they're complicit, right? So maybe they feel like this is something that they chose or something that they're responsible for, and that there's going to be some form of punishment for them. There may be feelings of hopelessness and helplessness. There may be feelings of shame or guilt. And when we talk about provider-related barriers, we see that it's really important for us to understand our own limitations, our own preconceptions, and other barriers that can prevent us as providers from identifying individuals who have these increased risk factors for trafficking or who are experiencing trafficking. So one common reason a provider may not identify an individual is a lack of knowledge around trafficking, which really can perpetuate negative attitudes about the client, especially if they have a criminal history of substance use disorder or they are seen as difficult to work with. So we know that this is kind of a huge issue. Some other provider-related barriers may be an overall, again, lack of knowledge about human trafficking, an inadequate understanding of federal, state, and tribal human trafficking and jurisdictional laws, maybe concerns about violating HIPAA. Maybe there is a lack of training for medical professionals that on this identification. So maybe you hadn't been trained before. Maybe you don't understand trauma-informed care. Maybe there hasn't been training around healing-centered interventions or culturally sensitive interventions. Maybe there's preconceived notions of how an individual has experienced trafficking will present, right? So there's an idea of what a survivor or a quote-unquote victim looks like, and what you're seeing in front of you does not align with that stereotype of what that victim may look like. Kind of, again, those things, maybe we don't believe it's our role to get involved, or maybe we're checking off boxes without seeing the full patient or the client situation. Maybe we think that asking will be time consuming or too complex. Maybe we're attributing these behaviors that this client is showing us as harmful cultural stereotypes, or we're misidentifying the case. Next slide, please. So there are a lot of misconceptions about the relationship between individuals experiencing trafficking and the trafficker, which can be another barrier to identification. So this chart that we have on this slide depicts findings from the Counter-Trafficking Data Collaborative. And this data set reveals that the majority of traffickers in instances of sexual exploitation are someone the survivor knows, right? So it's potentially an intimate partner, a family member, or a friend. And over a third of the traffickers were intimate partners, which suggests an overlap of intimate partner relationships in trafficking. And these findings underline the importance of not dismissing a potential trafficking situation just because an individual appears to be presenting with a relative, a friend, or a romantic partner, like I said earlier. Also, it's not uncommon for individuals to be exploited by someone with whom they have a close personal relationship. So, for example, a report in 2008 found that approximately 14% of individuals who were experiencing sex trafficking were recruited by family members. And I will share with you all, I work in Minnesota, and our most recent data, so we've been tracking child sex trafficking reports made to child protection in our state since the law. It was made a mandated report in 2018. So since 2018, 77% of all human trafficking reports of Indigenous children under the age of 18 included a parent or a family member as a trafficker. So that's a really, really, really high number, specifically in Minnesota, particularly as we're thinking of trafficking occurring within minors. And what we see, according to the Counter-Trafficking Data Collaborative, is almost half of the identified cases of child trafficking in their international data set began with some family member involvement. We also see common relationships between individuals experiencing trafficking and traffickers, again, as that intimate partner, family member, trusted adult, gang member, or peer of any age, gender, ethnicity, or race. For youth, it may be a relationship through activities like sports, extracurricular activities, or summer jobs. Many youth who recruit are also experiencing trafficking and do not believe they have a choice. Next slide, please. So you may encounter individuals who've experienced trafficking in many different situations. Labor trafficking involving minors can be especially difficult to identify. It occurs when traffickers manipulate hourly wages and or time needed to complete the work, and in cases of debt bondage, when the employee is told that they owe the employer money and must work off the debt. It is important to note that it is legal in most states for a minor to work, though each state may have varying minimum ages. And minors may experience labor trafficking in many areas, which include domestic servitude, in their home or elsewhere, door-to-door sales, the service industry, which includes hotels, motels, restaurants, etc., childcare, health and beauty industry, and agriculture. Next slide, please. Okay, so we have covered stop and observe, and now we have moved on to the ask portion of the SOAR framework, which is screening and identifying individuals who have experienced trafficking or who have increased risk factors for trafficking using this trauma-informed and person-centered approach. Next slide, please. This is one of my favorite things to talk about because so I used to work in tribal child welfare, and I worked previously as a child protection investigator. And so then I had to get really good at learning how to ask people questions. And now that I've transitioned into the human trafficking field, this is something that people are asking about on a really regular basis. They really oftentimes were not equipped with the skills, the tools, or the knowledge to really start these conversations when we have concerns for people. So I love just kind of sharing what it's like for folks and how we can better share our concerns and have conversations with people that we're worried about. So our role as as service providers is to really, first and foremost, we're seeking to understand and provide the level of support that they request. We don't need to be an expert in intimate partner violence, child abuse, or human trafficking to identify and respond to trafficking in our workplaces. Our role, again, is to understand the individual's circumstances so that we can provide support and refer them to these appropriate services. If the patient or client is comfortable with it, ask questions to evaluate and identify the risk of trafficking. Stick to the important facts that will help you identify appropriate services. Avoid in-depth questions about details surrounding a person's potential trafficking experience. Creating a safe environment and building rapport are foundational elements of trauma-informed care. And there are really several practical ways to enhance an individual's feelings of safety and security when we're asking about trafficking. So, for example, in some Indigenous cultures, it's really customary to offer traditional therapeutic medicine, such as sage, cedar, or sweetgrass for prayer, or other supplies that support an individual in centering, purifying, and warding off negative things. So it's really important to consider these customs when appropriate. It might also be helpful to engage in some degree of small talk to really break the ice and put the patient or client at ease. This is something sometimes referred to as visiting. And I just wanted to share with you all, there are so many fantastic videos in the lifestory.org. That was the video we weren't able to see earlier. There are some that specifically talk about individuals who come into or who experience trafficking and presented in emergency rooms and other medical settings where they knew that the providers identified that something was really bad was happening to them, and that these providers didn't say anything, and that this feeling of dehumanization where you know that somebody that you're meeting with is experiencing severe harm and trauma, and you're not respecting them enough to share that you're concerned about them. So that was something that really stuck with me in those life story videos. I'm sure as you watch them, some other things will stick with you, but just for me as an individual to hear that from a survivor's mouth to say, you know, these people knew that something was going on and they did not care enough about me to ask if I was safe or if I needed anything, that really stuck with me. So just recognizing that, being able to share those concerns, supporting individuals and their families really by understanding their situation and recognizing how abuse or violence can impact our health, our risk behaviors, and our relationships. So what are some ways that we can enhance feelings of safety and security when inquiring about trafficking, right? We can first of all ask permission before screening. We maybe will provide a brief tour of the building, especially if this is their first time there. So we're helping familiarize them with this new environment. We can talk about what services are offered on site, maybe offer coffee, tea, or water. We can explain our role and that of other service providers who may be involved. We can ensure interpreters are trained on human trafficking and interviewing expectations, really reviewing all documents that outline available services, confidentiality, and clients' rights. We avoid discussions about clients in public spaces, and we're really aware of these nonverbal cues and body languages that we're displaying, right? So we're not crossing our legs and shaking our knees. We're not showing that we are irritated or impatient. We're not crossing our arms. We're sitting at the same level as the person we're screening, and we're really avoiding displaying emotional reactions or judgments during the discussion, including judgments of the trafficker. So, next slide, please. Some ways that we can ensure that we are providing person-centered interviewing techniques include when we're meeting with an individual who may have experienced trafficking, it's important, again, to first create the setting that supports a person-centered trauma-informed approach. So we want to get informed consent prior to asking these sensitive questions about potential violence or trafficking. We want to make sure that we're letting them know the purpose of the questions, right? Why are we asking these questions? What are we going to do with them? Their answers. And we are ensuring that individuals are informed about confidentiality and any limitations, particularly any mandated reporting obligations you may have. And I am a mandated reporter, and I share with individuals immediately and often that I'm a mandated reporter, and I really outline all of the things that I'm required by law to report, so that they really know kind of what the consequences or what the responses may be, depending on if they're sharing situations that may include child abuse or neglect. For safety reasons and to promote an honest dialogue, it's so important to meet one-on-one for some part of every visit, and to have a policy in place to separate individuals from a potential trafficker when suspected. And then always using a professional interpreter who has been trained and will translate verbatim to ensure information is accurate when applicable. Next slide, please. So we want to ensure that we are inquiring through a trauma-informed approach. Simply asking questions is not enough to elicit information. So a provider must prioritize the individual's sense of safety and well-being. We want to minimize the need for them to retell their story. We want to offer education on trauma and trafficking, affirm the individual's resiliency and strengths, and then provide services and resources. So it's really important for us to remember that if we're not law enforcement or child protection, the goal of these conversations is not disclosure. Many individuals will not disclose for a variety of reasons. This can include fear, shame, distrust, or lack of awareness about trafficking. Our goal is to understand the individual's circumstances so that we can help connect them to the most appropriate services and resources. And there are often culturally competent screenings available at different urban Indian organizations or community centers. So maybe your program already has some culturally competent screening that's available that you're utilizing. And then there are also other helpful resources available from the National Indian Women's Resource Center, which includes a special collection focused on cultural competency, humility, and ally building in Indigenous communities. Next slide, please. So there are several different ways to identify the needs of somebody who may be at risk for trafficking or who is experiencing trafficking. And because evidence is still forming around these different approaches, we're going to talk about two different types. First of all, universal education and screening. And then we'll provide tools for each without recommending one over the other. So while these approaches can be used in any professional setting, providers can use universal education to provide information and resources to anyone, whereas screening tools are created and intended for use in a specific setting with a specific population. So some providers may feel more comfortable with a specific approach, or maybe you want to use a combination of both approaches, depending on available services and resources, what your community offers, what your program offers, and what's available for individuals. And we also, again, are seeing, again, current organizational approaches and processes and length of time with a patient or client really impacting which of the two approaches that you're going to be using. So providers are typically seeing a client who are typically seeing a client once or for a short period of time may find it way more helpful to use this screening tool, whereas providers that have longer or recurring appointments with patients may prefer this universal education approach. And it is also important to recognize that your partners may use different terms to refer to these approaches. So we really want to clarify, if you're in a multidisciplinary care, exactly what is meant by screening, what is meant by interviewing, or other related terminology. And again, neither of these approaches requires any form of disclosure. So universal education is, when applying this approach, we're inquiring about this individual's needs while simultaneously educating the individual on the ways that interpersonal relationships, work environment, or other social ecological factors may inform and influence that individual's situation. So even if a client doesn't disclose, we're offering resources in case something like that does occur in their life or does happen to someone they know. So I always frame it like, well, this may not be something that you've ever experienced, but I do want you to be aware of resources in case this is something that you come up against, or if it happens to somebody you know. So just sharing with you what this looks like, what the different services look like, et cetera, et cetera. So then the relationship with the individual really is one that's based on partnership, where this individual and the provider are determining together which services and resources are appropriate for the individual. And it can be used with anyone regardless of their age, race, gender, risks, or red flags. And by using this universal education approach, providers can reach more people as a form of both prevention and intervention. And this is something, if you're interested in learning more about universal education, there are a ton of tools on NITAC's website. And even there are like proposed scripts when you're sitting down with an individual, how you can frame different kind of conversations based on the individual's experience or their background. So there are so many resources available for that. And then when we talk about screening, for screening, it's really most frequently done in healthcare settings and behavioral health settings, where red flags or indicators already indicate risk specific to human trafficking. We have our providers using a standardized set of yes or no questions to identify the individual's risks that may link to human trafficking, so that they can determine which services and resources to provide. And this relationship between the provider and the individual tends to be more hierarchical, right? So our provider is determining which services and resources the individual qualifies for based on these answers to these questions. And the provider should be aware of the setting and population with which the tool was tested or validated. So screening tools really are only to be used with specific population and environment for which they were intended. So that's important to recognize, that you may have a bunch of screening tools available to you, but none of them are created for an urban health setting. So then they may not be the appropriate screening tool for you. Next slide, please. Here are some examples of some validated tools. So we have, and I'm not going to talk about these in depth because this is something that you all can look up, but we have, first of all, listed is the Quick Youth Indicators for Trafficking, which was developed by Covenant House, New Jersey, specifically to identify labor and or sex trafficking among homeless young adults between ages 18 and 22 in service provision settings. We have this rapid appraisal for trafficking, which is a 4-item trafficking screening specifically developed for use in healthcare settings, and it was validated in 2021. We have short screen for child sex trafficking, which is a 6-item tool developed for and evaluated in healthcare settings with high-risk adolescent populations. And this is the only screening tool validated for use in these settings. And then finally, we have an adult human trafficking screening tool and guide, which was developed by NITAC to train public health, behavioral health, healthcare, and social work professionals, really to use this trauma-informed, person-centered approach, assessing adult clients and patients for trafficking or risk of potential trafficking. And this one is not validated. Next slide, please. So how can we engage with youth? Many of the considerations for engaging with youth are similar to engaging with adults, and it's always important to enhance feelings of safety and security and use a trauma-informed approach. So, sorry, I worked with a mental health provider who has worked exclusively with human trafficking survivors for the past, I guess, 8+ years now. And one tip that she shared with me was that as a service provider in this field, it is so important to just assume that someone has a trauma background, right? So particularly for individuals who have experienced complex trauma in their lives, for those of us who are meeting with them, every interaction we have has the potential to either be healing. So again, we're using this trauma-informed approach. We can interact with them in a method that is healing and helpful, or we're interacting with them in a way that is harmful. So really just looking at that as like two sides of a coin, that there really are only two options when we're interacting with somebody who's experienced trauma, that our behaviors, our communication, the words that we use, our approach, our body language can be something that is seen as helpful to the individual, or it's something that is harmful for them in their trauma journeys. So with young people, we really want to avoid overly formal clothing, right? And we want to start by introducing ourselves in a non-formal way. So we don't want to make it feel like an interview. We want to avoid taking notes or having a pen and paper if possible. We want to inform the child that if we're mandated reporters, and we really want to, again, outline what does that mean? What are the things that we are required by law to report? What will that look like? How do we, who do we report to? In my field, I always share with young people that if they do end up saying something to me that does have to be, that ends up being a mandated report, that they have the option and opportunity to sit in the room with me while I am making that mandated report over the phone, so that they can be a part of the conversation. So really involving them in that process. We want to focus the conversation on prevention, not only for them, but for their friends and loved ones as well. We want to help them identify people of trust in their life, and then also be prepared with additional suggestions. So we also want to keep in mind that children may be abused by individuals they trust who are close to them. So it's really important to provide guidance on appropriate and inappropriate touch when it is within our role to do so. We also want to allow ourselves to be vulnerable, right? So if they mention a term or an app that we're not familiar with, we can admit it and we can ask them if they want to talk about it or explain it to us. This, I think, is really empowering for young people, and it kind of gives them a little bit of, again, power and control back in these conversations, and helps them recognize that we as adults are not experts on all things, and that they as young people can also be on experts as things that we don't necessarily understand. And finally, when we're meeting with them, we really want to be using a strengths-based approach by focusing on the strengths, resources, gifts, skills, and talents, or relationships that these young people already have that can help them address their situation or challenge. Next slide, please. So we may not be able to see every individual alone, and it's important to really think about how we have a protocol in place to respond in these situations. So if we are suspecting that an individual is in our setting with somebody who may potentially be a trafficker or a recruiter, we really need to come up with a plan that allows the provider to speak with the individual in a private, safe environment. We really want to ensure that we are, again, maybe going through a screening or universal education with this individual, looking at how we carry out this actual separation process, and what will occur if the person accompanying the individual refuses to leave their side. So just thinking of these different things as we're coming up with internal protocols. Next slide, please. We also want to think about mandatory reporting and compliance with HIPAA. So in some cases, providers really have hesitated to report potential cases of trafficking because they're afraid of violating HIPAA. And while it was written to protect individual confidentiality, it was never designed to prevent reporting trauma and crimes, right? So thinking about that, HIPAA permits reporting injury or abuse if certain conditions are met, including those shown here. And if an adult authorizes disclosure, even if those conditions do not apply, HIPAA requires that the disclosure is limited to the terms of that individual's authorization. Human trafficking can be reported without divulging personally identifiable information. So for example, you could report an individual's gender and age and the type of trafficking, but not the date of service. And it's really important to consider the risk involved with making a report, particularly for individuals who are undocumented. Maybe they're being forced to commit a crime as part of their trafficking, or they may otherwise fear unequal protection due to race or other status. So we really want to be taking those issues into consideration before we're making reports. And for reporting purposes, healthcare providers and hospitals now have human trafficking diagnostic codes, or ICD-10 codes, which can help you differentiate patients who have experienced trafficking from patients who have experienced other form of abuse. And these can also help providers gain a full picture of the patient's circumstances and respond in a person-centered, trauma-informed, and multidisciplinary way. Next slide, please. All right, we have a knowledge check. I think that we have already seen this one, but let's try it again. And true or false, it will pop up for you guys, the poll. When screening an individual who may have experienced trafficking, providers should try to get as much information as possible about the situation. Now we've covered it, so this is less of a trick question for you all. And we only just have a little bit of time. So while you guys are working on the poll, we will continue on to our final section of the SOAR framework. Next slide, please, if possible. And that is respond. So what do we do? How do we address individual needs by coordinating across multidisciplinary partners to deliver these appropriate services in culturally sensitive ways? Next slide, please.
Couldn't function from day to day like how some people do. I had a lot of depression, and so I was still turning dates. It's hard to function in this world that doesn't understand me. This housing program wants me to do this chore like once a month, like let's say it's vacuuming the hallway, which is not, you'd think it's not a big deal, but there's men in the building. I can't explain why some days I can't get up. I can't move. I can't be happy. All I could do is just cry.
Excellent. All right. So now we're going to talk about just briefly about trauma-informed care. So you have the opportunity to support individuals with increased risk factors for trafficking and those who've experienced trafficking in a variety of ways. And while your role may vary depending on where you work, the types of services your organization provides, and the population you serve, excuse me, so sorry about that. It is important to use a trauma-informed and culturally and linguistically appropriate response. And so then we're not going to go through each of these different things, but just thinking about ways that you can take each of these bullet points into consideration when you're working with individuals. Next slide, please. All right, now we get into the fun stuff. So here is not an all-encompassing list of different strength and protective factors that we as Native folks have. So this is something that came from the Human Trafficking Leadership Academy class that I was in. Again, we had really went over those risk factors earlier, and these are the protective factors that we identified based on research, based on interviews with survivors and conversations with different programs across the United States. And we really were able to identify that there are strength and protective factors that are occurring really in the same formats and spaces as there were risks for. So then we were having these strength and protective factors on an individual level, on a relationship level, within our communities, within our societies, and really looking historically. So I'm also not going to cover all of these. You absolutely can look at them in depth in the slide deck when it's shared, but can we go to the next slide, please? So we really want to focus on understanding, honoring our culture and tradition. So as we shared with those Indigenous strength and protective factors, connections to culture and tradition serve as a protective factor. When working with Indigenous individuals who have experienced trafficking, we want to be looking for ways to connect them to their culture and their community. We want to be aware of the different tribes, cultures, and practices among the populations that we serve. So, for example, some Indigenous people living in urban communities may not be as connected to their culture and traditions because their ancestors might have been forced to move from their homelands, and they may have been stripped of their cultural identity in the process. We also want to remember that no one community is the same, and that each community has very different histories, traditions, cultures, beliefs, and needs. So it's super critical for us to ask survivors about their own culture and traditions and how they would prefer to incorporate them. Next slide, please. We also want to bring about meaningful change in Indigenous communities and reduce the incidence of human trafficking through these following interventions, which really could have a big impact when they're implemented proactively. So we want to ensure that we're engaging schools in prevention and identification. We really want to be addressing poverty and resource disparities to improve long-term self-sufficiency. We want to ensure that we're increasing awareness of common indicators of human trafficking. We want to create opportunities for individuals to be connected with their culture, really to promote health and wellness. And we want to be encouraging developing self-regulation practices. Actually, I was going to go in depth into these, but we'll just go on to the next slide for that as well. So it's important to note that we as Native individuals are resilient, and that is one of our core protective factors as Native communities. So we have the American Psychological Association defining resilience as this process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And regardless of somebody's life experiences or current mindset, we can learn and develop traits that promote resiliency through positive connection with others, moving towards self-defined goals, and learning to broaden our perspective. So individuals who have experienced trafficking or who may be at risk for trafficking really need service providers to help play a role in promoting this resiliency. Next slide, please. Another thing that we really want to ensure is that we're involving elders and leaders. So for example, there's a tribe in Alaska who partnered with local researchers to develop a program that partners youth and elders in shared activities and lessons aimed at reconnecting youth to their cultural values and ancestral traditions. Love that so much. In Washington State, Innovations Human Trafficking Collaborative, which is a direct service organization, has a memorandum of understanding in place with an elder-led organization. And through this partnership, Innovations Human Trafficking Collaborative works with elders of different tribes to provide their insights and oversight into the work that they're doing. And these elders are also a part of the mobile response team, helping individuals who have experienced trafficking connect with their culture. So just some examples, there are many, many, many others as well. Next slide, please. So to apply SOAR in your workplace, you'll need a protocol for working with individuals who have experienced trafficking or who have increased risk factors for trafficking. These protocols are guidelines created for an organization to help create or help guide care providers in the appropriate response to trafficking. So the components of a human trafficking protocol should include staff training and supports, screening and identification, interview procedures, safety planning, mandatory reporting, multidisciplinary response, follow-up or follow-through procedures, and then continuous quality improvement. Next slide, please. And a valid component or a vital component of responding to trafficking is collaborating across sectors. And really, every individual who has experienced trafficking is unique and will require a different mix of services. It is important to understand and to remain within the appropriate scope of practice for your specific role and your license, and look beyond your organization when referring an individual to services like legal aid, housing, medical care, and behavioral health services. And I think that this is particularly important when we think about survivors and individuals who have experienced significant trauma in their history. It's really important that we're not siloing services. We want to ensure that individuals have a plethora of resources and individuals available to support them, because we may have misconceptions or miscommunications with them, and we don't want them to feel like they have no one else to turn to. So really, the more support that we can get them, the better outcomes we can create for these individuals. And we really want to keep in mind that access to services may depend on tribal membership as well, right? So in urban settings, providers may see enrolled members of federally recognized tribes, state recognized tribes who don't qualify for IHS services, or non-enrolled community members, right? So this is going to vary depending on the program that you're working in. But we really want to connect with these program coordinators who may link individuals to these different tribes and services through partnerships, through collaboration, and all of those positive things. Next slide, please. We also want to remember specifically adherence to ICWA. So ICWA was really established for these minimum federal standards for the removal of Indigenous children from their families, which require that they are placed in foster or adoptive homes that reflect their Indigenous culture. There is a renewed emphasis on an adherence to ICWA mandates, which is important because of the high rates of Indigenous children really currently in the child welfare system. And this, I know, varies from state to state. Some of our states, particularly, I'm thinking again of the Midwest, our rates of out-of-home placement for Indigenous children is absolutely appalling. Some states are doing really well. So, but truly, we want to ensure that we are promoting adherence through ICWA. We're really focusing on increasing data collection and monitoring. We really want to address disparities in Indigenous communities. We want to enhance partnerships between states and tribal nations. We want to mandate trauma-informed cultural humility training for staff. Next slide, please. So, this training described human trafficking in the context of Indigenous communities and why it is of critical concern to your work. For more information about the SOAR framework, there are additional modules in SOAR online. It is fantastic. I cannot sing SOAR's praises enough. They are just such great resources. There are a lot of different scenario examples if you want to get more in-depth learning and kind of just look at what trafficking may look like in different settings, how you can screen for it, et cetera, et cetera. So that is a really great resource just to learn more about this framework. Next slide, please. And SOAR was created by NITAC and is implemented through NITAC. And we also have the National Human Trafficking Hotline. And this is something that is funded by the United States Department of Health and Human Services, and it is another resource available to you. So it's a national anti-trafficking hotline that serves people who are experiencing trafficking and the anti-trafficking community in the United States. Anyone can call the hotline, chat with an advocate, text, or submit a tip through the anonymous reporting form at any time. It's open 24/7 every day of the year. So these are all of kind of the different things that are available for individuals. Next slide, please. We also have the Strong Hearts Native Helpline, which is a safe, confidential, and anonymous helpline for Native Americans affected by domestic violence and dating violence. This helpline takes calls related to human trafficking, domestic violence, and sexual violence, and it connects callers to the National Human Trafficking Hotline when needed. If it's not safe to call, they have online chat and text advocacy sessions available, and users receive one-on-one, real-time confidential information from a trained advocate, and support and referrals to resources are available for free 24 hours a day, 7 days a week, which is another fantastic resource. And next slide, please. So this is contact information for NITAC. These are the individuals who, again, are implementing SOAR. You can reach out to them. You can check out their website, nitac.acf.hhs.gov, or you can email them at info@nitac.org, or specifically for inquiries about SOAR, you can email them at soar@nitac.org. Here's their phone number, and they are located primarily on the East Coast. So their office hours are between 8:30 a.m. and 5 p.m. Eastern, Monday through Friday. Next slide, I think this is our final slide. So if you have more information, or if you're interested in getting more information about SOAR online, please feel free to reach out. Check out this link to see, again, more information on SOAR. And I believe that concludes my portion of this presentation today. So if you guys have any questions, please, please, please feel free to reach out, ask them. I'm happy, obviously, to stay extra time and answer any questions that you may have.
Thank you so much, Annie. We are coming up to the time for folks, but if you have any additional questions, please feel free to enter them into the chat, and we will send a message with a recording of this video as to attendees within 48 hours after the conclusion of this training. So
Also, I'm going to
yes.
share a link to the lifestory.org in the chat as well, which again, I have spent so many hours on that website. I do have a friend who is a part of the Life Story. She was one of the folks who was interviewed. So it's particularly like heartwarming for me to see it and to like know her now and hear about her story and just be like, oh, this is such an amazing thing. So very cool resource.
Absolutely. Thank you. That's wonderful. Thank you for sharing, Annie. So thank you again so much for joining us for this important session on MMIP prevention. We appreciate any feedback that you have and you would like to provide about your experience today. Please complete your session survey by using either your phone to scan the QR code on this the slide that was before, or click the link that was placed in the chat box by Zoe. So if you have any questions, please feel free to reach out to my email, mcurry@nakui.org. There's also these upcoming events. We have some that we would love for you all to join. Please join us for Sustainable Workforce Growth through Internships on March 28th, and then Elders Bridging the Workforce Gap on April 9th, excuse me. Again, thank you so much for joining this important session. Any feedback you would like to provide about your webinar experience, please do not hesitate to reach out or complete our session survey. Excuse me. Thank you again for attending. And we have also provided our info for our one-on-one technical assistance that's available. So if you are a UIO and provide support to member UIOs, please reach out if you need some technical assistance from NACUI. We can provide those for you as well. And there's the link to scan for our post-event evaluation survey. So thank you so much.